So you're thinking about becoming a psychiatric mental health nurse practitioner, but you're looking at the pros and cons, and for some reason, you can't find any of the pros or cons. Well, in this video, I'm going to be going over 5 pros of why you should be a Psych NP, so stay tuned. Welcome back, Psych Dude family. It's good seeing each and every one of you guys today. If you are new to this channel, let me formally introduce myself. I'm the Psych Dude. I'm a board-certified psychiatric mental health nurse practitioner. And in this channel, I go over several different subjects to educate the public about mental health, ways to improve your lifestyle, topics related to mental health, nursing, nurse practitioners, and specifically psychiatric mental health nurse practitioners like myself. And if you are interested in these topics, definitely feel free to subscribe, give this video a big thumbs up, and follow me on Instagram at ThePsychDude. So you probably clicked this video because you're wanting to know what the pros are of being a Psych NP. And honestly, there's not that much information out there because, yeah, we're not that known compared to all the other specialties as a nurse practitioner. The reason being is because there's not that many of us. So yes, in this video, I wanted to go over those pros with you because if you're on the fence of being either a family nurse practitioner, which is a good specialty, or being a psych nurse practitioner, or being adult jury nurse practitioner, these are the reasons why you want to look at it, and these are the reasons why I love being a Psych NP, because I'm able to impact those reasons. So without further ado, let's get started on the top 5 pros of being a Psych NP. So the very first pro is you get to fill the gap of the shortage of psychiatric mental health professionals out there. The beauty of being a Psych NP is you're able to fill in that gap. And there's not that many of us, like I explained earlier, so you're able to help the amount of people. And think about it, with the less amount of providers and the abundance of patients, you're going to be able to fill that gap so we can get closer to actually giving patients the accessibility they need in order for them to get the mental health care that they need. And that's the most important thing, especially about being a Psych NP or just working in the healthcare field in general, is we want to be able to impact patients and provide the highest quality of care possible in order for us to be successful in the position we are. And as a Psych NP, you're going to be able to fill in that gap, and that's a huge pro for us because there's not that many of us, and if you love helping, which I love doing, then you're going to help more people as a Psych NP. Second pro of being a Psych NP is your knowledge base on medications is going to grow so much. And being an RN is amazing, don't get me wrong, you get to learn so much pharmacology while in school and when you're in the job. But when you become a Psych NP, you get to take psychopharm. Think about it. You get to learn so much more about these psychiatric medications. And when you get out of school, you get to learn even more, especially from the drug reps. Yes, there's a common misconception where people think that drug reps are just out to get you, try to swindle you into prescribing their medications, which I can definitely see. But at the same time, if you don't necessarily listen to these drug reps, you're not going to necessarily learn about that specific medication. And you don't want to be the person that's constantly using all those old school medications, going back to the drawing board and trying to figure out, oh, will this medication work? Will this medication work? Yes, you want to trial certain medications, which is important, and making sure that you maximize the medication prior to moving on. But if you're stuck at a standpoint where you don't necessarily know what medication to use, and they've been using all of the different types of medications, then obviously you know that this is going to be your next step, and you're going to be confident enough to be able to prescribe that medication because you learned about the medication. Like I said, you're going to learn so much as a psych nurse practitioner. It's crazy. Even the commercial, or even the medications where they have commercials on TV, even when they're prescribing or telling you about the symptoms, you're like, oh yeah, this medication is for this, and this is what the medication is, even before they say it. And it's crazy. Like, you're gonna learn so much about psychotropic medications. Whew. Sometimes I get so excited just learning about all of these types of medication that whenever I try to learn and explain the medication to the patient, it gets them excited because they think that this is going to be the medication that's going to help fix them, and hopefully it's the one that helps decreases their symptoms and gives them that higher quality of life. So the third pro of being a Psych NP is you get to provide different modalities of psychotherapy. Yes, guys, we can do therapy. And that's the beauty of being a Psych NP. A lot of people think all we do is medication management, which is true in some jobs, but for the most part, we get to try different and actually provide different types of psychotherapy. We get to do CBT, we get to do DBT, we get to do supportive therapy. We get to do so much, and the beauty of it is we learn the basics in school. We're able to provide some therapy hours within school, and then outside of school we can apply it and get even more certifications to learn even more. And yes, guys, I know what you're thinking is, are we able to bill for psychotherapy? Yes, guys, we are able to bill for psychotherapy. And the beauty about being a Psych NP, especially for the people that want to do a combination of both medication management and therapy, we're able to do that no matter what. We're able to bill for both. We're able to provide that service, so we can be a one-stop shop for patients, especially if you're able to do all of those things under the same building. And that's the most important thing, is to be able to provide both services under your own one roof and do it with the patient, because you'll understand, okay, this is the medications they're on, this is what they need, and you're going to be able to bring them back together to where they want to be in their life. And I think that's a huge win for us and a huge pro for being a Psych NP. So the fourth pro of being a Psych NP is we are in such high demand. It's crazy how much we are in demand. There's so many job opportunities out there. Yes, it's a little bit harder as a new grad, don't get me wrong. The reason being is because there are not that many people out there willing to teach. Especially psychiatrists, they're not willing to teach as much. And Psych NPs, they don't want to teach as much either. Especially for the people that don't necessarily have experience. Well, that's a topic for another video. But what I'm saying is, you have to look for the job that you want. There's so many different jobs in so many different areas around the country where you can be a Psych NP. You just have to be willing to move. Just like being an RN. There are a shortage of RNs, but depending on which state you're at, there might not be a shortage because there's so many RNs or NPs there. So you have to be willing to move out of state to get the experience and then move back to California. Like for me, I have 2 years of experience, so a lot of the places are willing to hire, and there's so many different jobs out there, so many different recruiters hitting me up for jobs because I have experience. Yes, it might be harder for someone with no experience, just like I said, because not that many people are willing to teach or precept. So that's something to think about. But once you get that experience, it's crazy for the amount of people they're willing to hire at certain organizations, especially because they need to fill that void and they need to be able to hire someone to be able to take care of all of their patients. So yeah, we're in high demand. Like, that's a huge pro as being a Psych NP. So the fifth and final pro of being a Psych NP is career paths vary. So the beauty about being a Psych NP is you can work in so many different settings. You can work inpatient, you can work outpatient, you can be in a community mental health center, you can be doing rounds in the hospital, you can do rounds in SNFs, you can work for insurance companies, you can work for pharmaceutical companies, you can do telepsych, you can do so much, especially as being a Psych NP. And that's the beauty about being a Psych NP, is because if you get tired of one area, you can always move on, and you can always be in multiple settings if you want. Take me, for example. I'm in 3 different settings. I'm in the urgent care, I'm in the outpatient world, and I do telepsych. I love all of the things I do because every single position that I have, it varies in the amount of how fast or how much work I do and different acuities. Like in the inpatient or in the urgent care, I get to see highly acute patients because they can either come in extremely psychotic, extremely manic, or extremely depressed or extremely anxious, and I get to treat that. But if in the outpatient setting, typically they're going to come to you stable, either coming from the hospital, getting primary care referral, or just coming in. And on the telepsych side, I get to see best of both worlds, but the beauty of it is I get to be at home and I get to see patients through my computer. I love what I do. Trust me, you are gonna love what you do, especially as a psych NP. A lot of people say there is burnout. I definitely do agree with that, but you have to figure out what area that you can work in that's going to prevent you from burning out. I can definitely see how burnout can be real, because when I do certain amount of days in one area consecutively, I felt burnout. But now that I kind of had a good balance about my jobs and what I do, it feels even better, like, because every day is brand new, nothing's like repetitive, nothing's redundant. I just get to do what I get to do, and I love it, and I love every minute of it. And I'm blessed, and I'm glad that I came down this choice, and I'm glad I chose to become a psych NP, because I was definitely going the FNP route, because I actually switched into ER at the time of starting the program, and I love the ER. I love doing what I'm doing, so I was thinking about going the FNP route and then doing another couple years, and then go into become a ER NP. But I'm glad I chose to be a psych NP. And yeah, like, if you are on the fence of trying to decide which is going to be the right route for you, which certification or which specialty you want to be, definitely consider being a psych NP, because there's so many pros, and definitely there are cons, and I'm going to make a video about that coming out soon, the cons of being a psych NP. But like I said, there's so many different pros that you definitely take all of these pros into consideration, because you never know where it's going to lead you. Well guys, this is the end of my video. I hope you guys truly enjoyed this video, and I hope you guys, I hope it helped you trying to decide on what your next step is. And if it hasn't, then definitely watch all my other videos, because I'm definitely pro psych NP, because I absolutely love what I do, and this is the best decision I've made so far in my life. Well, besides finding my wife and asking her to marry me, but for the most part, I love what I do. So definitely do more research if you are on the fence. Watch some of my videos and definitely make the right decision for you. Yes, I am pro psych NP, but whatever route you go and whatever route you choose to do, even if it's not a psych NP, definitely leave a comment down below and tell me your reasons, because I want to see what people's reasons are, just so I can kind of expand my mind also. Well guys, as always, have a wonderful day. Until next time, bye!